I think so. I think post-prostatectomy cancer patients do really face a tough difficulty because number one, they undergo surgery for cancer care, which sometimes can sacrifice their quality of life. Having been the last chair for the International Consultation of Sexual Medicine on post-prostatectomy sexual rehabilitation, it really opened my eyes as to what patient suffering is all about, because the traditional idea is all about patients suffering from a penile disorder, meaning that they have erectile dysfunction. But we do really need to understand that when a patient undergoes treatment for the prostate cancer, there's a lot of other factors that's involved. From a psychological point of view, the psychology of undergoing the surgery, the stress of the cancer itself, the treatment regret, which is something that is underappreciated at this point in time. A lot of patients that undergo the surgery sometimes wonder back, should I undergo the surgery in the first place? And number two, am I being overpromised on the delivery of the quality of health outcome? So we now understand that when we talk about erectile dysfunction in this group of men, we really need to broaden the topic to sexual dysfunction, because we understand there's a lot of interplaying factors from erectile dysfunction, from the other form of male sexual dysfunction like lack of desire, libido due to the cancer effect, changes in the interrelationship from an ejaculatory point of view or orgasm point of view. Some of these men suffer from urinary incontinence. Some of these men lost job or have deferment of their job. So from an employment point of view, there's a change in financial status and change in social status. So it's really important that you need to address the man beyond just the penis itself. I think it's important as a surgeon that you really need to evolve with time, because if you can't keep up with the practice and also the change in the trend, it's very difficult for you then to deliver the care to your patient, because patients nowadays are becoming smarter, so they demand more and more out of the surgeon. So traditionally, a patient will come to see you and you ask you what you can do for them, and then you tell them this is what you're going to do, and they will accept it. But nowadays, patients are now faced with the idea of trying to Google to see out what's going on. Some patients are really smart. They can actually go into website and look at your publication and look at what you have been doing in the past. So right now, as a surgeon, you have to evolve with time. So we evolve with time means that number one, not only do you have to keep up with the current ideas and also the current publication around what is key important in your specialty, and number two, you really need to understand the mindset of patient. So this is something that I think many surgeons fail to appreciate. The mindset of the patient are changing now. No longer is the patient asking you, do something for me. The patient is asking you now, what can you do for me? Not what I can do for you. So I think this is something that's very important. So as a surgeon, we have to grow. In order to grow, then you can understand what you can deliver to the patient. Well, hopefully in 10 years' time, if we really have gene therapy working, all the cancer will be prevented. Therefore, there will not be any need for prosthetic surgery. But I think unfortunately that is a reality that will never happen for two reasons. Number one, patients are getting older. Despite the improvement in technology, more and more patients are getting older. As patients get older, you get medical conditions that sometimes can lead to erectile dysfunction. And the second point is that more and more patients now are seeking simpler solutions from that point of view. So as a surgeon, when you look into the future, you really need to look into the quality of life. When we talk about quality of life, we're not talking about addressing one single organ, but you need to look at it from a holistic point of view. So I think in the future, when we talk about penile prosthetic implant, we really need to be able to address every single facet of a male sexual functioning. So we move away from the term erectile dysfunction into sexual dysfunction. So we need to look at the sexual health in general, and then we need to look at what we can do to deliver them. But specifically from a penile prosthesis point of view, we really need to look at a device that is simple, a device that has limited recovery time, so the patient can come in and out very quickly without minimum disturbance to their quality of life, and yet importantly, to enhance their quality of life. Because right now, all we can do is to get patients to hopefully where they used to be, but they're not going to be better. But in the future, we need to demand better healthcare. So we need to get patients not to where they used to be, but in fact, better than where they used to be. So it's almost like a reverse aging point of view. So this is what I think the future is going to hold in prosthetic surgery if we can get there one day. It's a very difficult question because this is a question that you really want to contemplate for a long time. What research do I really want to do? Obviously, as a clinician, we really want to try to prevent disease from becoming a problem. But the reality is that this is not going to be quite possible despite what we know from all the scientific discovery. So I guess from my point of view, what do I really want to do? I guess number one is try to be a humanized surgeon. A surgeon that can hopefully deliver a good quality of care to my patient, and more importantly, make a positive impact on the patient's life. So that patient then will say to me, Dr. Chung, you have helped me and you have made me a better person. I think that is what I really want to do for future research. I think so. I think in general, when you make someone happy, you get positive energy from the patient, and that positive energy bounces you back. So it's an exchange of what we call the positive energy or the karma. So I always believe that as a human being, you do good to others and others will do good to you. So I think making the patient happy certainly make myself happy. And by making myself happy, hopefully I can make the next patient happy as well. So it is like a karma circle. So everyone become happy towards the end, and hopefully we achieve something that is satisfactory to our life.